We are students in Indiana State University's Doctorate of Athletic Training program. Today, we'll be demonstrating techniques to treat SI dysfunction presenting with the following symptoms. Patient reported into the clinic stating that they had pain in their right low back for a period of almost a year. Patient stated that they were lifting a heavy box and turning to the right side when they felt the pain. The pain is exhibited in their low back and nowhere else in the rest of the body. Patient states that they have pain while walking for long periods of time and while sitting for long periods. Lower extremity flexibility is normal and there is weakness in the right hip flexor. The patient also presents stating that they feel that their low back and hips are off slightly. So when the long sit test was propagated, the symptoms presented with a longer leg on the right side, presenting that the patient has a posterior nominate rotation that is needing corrected.
All right, so after our evaluation, Tim, I think I have an idea of what's causing some of your low back pain. And a lot of our tests kind of have pointed toward the direction of your sacroiliac joint. And so, you know, this is basically, I have your spine and your pelvis here, a model. And so here's your pelvis, and then this bone right here is your sacrum. And there's a joint in between those. And normally it doesn't really move that much. It moves a little bit, but most of the time it just kind of stays pretty well still. I think when you had that initial injury, this pelvis side might have gotten rotated backwards on there. So the way that our exam has kind of played out is that this bone right here may be rotated backwards. So there's a backwards rotation. When I do that, if I take this and go backwards, that obviously puts some stress on the low back. If I do that, you can see it puts stress on the low back. And it's also going to stretch out some of the musculature that's right there. So our treatment plan is going to really focus on restoring that position of the pelvis and the sacrum and strengthening that musculature that's been stretched out for so long. Do you have any questions about that? All right, Tim, we're going to start with a couple exercises just to move that sacrum on the pelvis like we talked about. The first one is really mild. Just want to get a little bit of movement to kind of start getting those ligaments loosened up a little bit so we can do some of the other mobilizations, okay? So we're going to start by just go ahead and lay on your back, so slide all the way back on the table. And again, this one shouldn't feel very uncomfortable. If you do feel some sharp pain, please let me know and I'll back off. But it's really, I'm just going to kind of get you in a position and then just kind of move you back and forth for just a little bit, okay? All right, so the first thing I'll have you do is take your arms and cross them across your chest, and then we'll take this leg and cross it across the other one. And then I'm going to have you kind of bend in a kind of a C formation. So if you take your legs and kind of go like that, and your upper body kind of get in that position there. I'm going to get my timer. We're going to do this for about 30 seconds, okay? So I'm just going to let that go so I can have an idea. Before we get started, let me turn you up here and do a little bit of rotation, keeping that. And then what I'll do is I'll come down here, and then all I'm going to do is just kind of go back and forth. All right? How's that feel?
Fine.
Any pain or anything? No. Okay, we're going to do this for about 30 seconds. Still good here? Okay. That was it. Come right back down, and we'll get you back to normal. We can rest just a little bit. All right, so we'll do one more of those on the same side. So go ahead and cross your arms again, cross your leg, and then if we can go out in that position here. And then we'll get you side bending over here. I got my timer right there. We're going to kind of rotate your torso this way. And then I'll get down. And then again, we'll just go 30 seconds right here, just like we just did. You doing okay there?
Uh-huh.
Okay. And again, just let me know if you have any pain. About 10 more seconds here. we're gonna do on the other side. So Tim, we're gonna do the other side now, just to be fair and make sure we get both sides moving. So again, we're gonna do the same thing, just the opposite side. So if you'll just cross your arms like you did, and then we'll get these legs out here. Want to get your side bending up here, like that. Keep that side bend, and then rotate up here like this. There we go. And 30 seconds of this. Again, how's that feel?
Fine.
Okay. And where are you feeling this?
In my low back.
Okay. Good. Okay. Relax. And just relax for a little bit. And we'll do one more time. All right, so let's cross your arms one last time. Go ahead and cross your leg for me. And then we'll move this just like that. We'll move your upper body across there. And then again, we'll kind of just do a little bit of rotation here. You can pull your neck up there, and then there we go. And then we're just right here for 30 seconds. Again, just let me know if you have any pain, any sharp pains.
I'm fine.
Okay. And no problems at all? Very good. Well, that was good. That allowed us to get, like I mentioned, that allowed us to get those ligaments, basically a little bit of movement. Now we can progress on to some of the other movements to kind of get that pelvis and that sacrum kind of moving on each other, okay?
So this next technique that we're going to perform is a mobilization with movement. And this technique is used to correct your posterior rotation of your right hip. What I'll have you do, you'll lay on your stomach, and I'm going to apply a downward pressure to the back side of your right hip. Once I have that pressure, I'll ask you to press up into a press up position, hold for a second, and then lower yourself back down. To perform the full technique, we're going to do 6 repetitions and 3 sets. This should be pain-free, so if you experience any pain during this technique, please let me know, and I'll make sure I readjust my hand positioning to try to decrease that pain. Do you have any questions for me?
No.
Okay, go ahead and lay down on your stomach and we'll get started. So I'm going to place pressure right through here. Does that feel okay?
Mm-hmm.
Okay, go ahead and press up for me.
It hurts right there.
Right there?
Okay.
Okay.
So I'll just go that far, right?
Yep.
Okay.
Are you ready for your next set?
Mm-hmm.
Does that still feel okay?
Mm-hmm.
Okay. We'll do one more.
I think I can go a little farther this time.
Okay. Still pain-free?
Mm-hmm.
Good.
this is another technique we will utilize to correct your posterior rotation that you're having in your hip on the right side. This is a muscle energy technique for that correction. So what I'm going to do is I'm going to have you lay flat on your back on the table. We're going to utilize the uninvolved side. You're going to flex your knee up into 90 degrees of flexion or flex your hip 90 degrees of flexion and your knee to about 120 degrees of flexion. And you're going to your right leg, which is your involved side, you're going to have that flat on the table.
Okay.
So I want you to go ahead and lay down like that, or I flex up about 120 degrees there, and make sure your foot's up off the table a little bit like that. And I'll hold you right here. So what I'm going to have you do is I'm going to have you push. I'm going to put my hand right here. I'm going to have you push into my hand whenever I give you the cue. And I'm going to have my other hand right here. I'm going to have you raise your leg up into my hand. And I don't want you to do full force. It's about 30 to 50% effort here. So I don't want you to like push me up into the wall. So just whenever I give you the cue, we're going to hold that for 6 seconds, and we're going to do about 3 repetitions of that. Okay?
Okay.
So if you have any pain or anything, let me know, and maybe we can readjust and try it again. Okay? So go ahead and push up and into my hand. 1, 2, 3, 4, 5, 6, and relax for me. Any pain or anything with that? No? Okay. I'm going to give you a little rest, and then we're going to try it again. All right, ready to go? Okay. 1, 2, 3, 4, 5, 6, and relax. I'll give it a rest, and then we'll try one more time. Okay, here we go. Push. 1, 2, 3, 4, 5, 6. Any pain or discomfort with that?
No,
Okay.
that's pretty good actually. Thank you for taking the time for watching this video today. If you have any questions about any of these techniques that are utilized in the video, you can contact us at the information that is provided.